Virtual reality and haptic simulation and modeling microsurgical endodontics, a case report and proof of concept, which was presented by Pasqualini et al. In 2025 and was published in the International Endodontic Journal. The modern endodontic microsurgery integrates the use of an operating microscope, a minimally invasive osteotomy, a zero-degree bevel root end resection, ultrasonic assisted root end preparation, and biocompatible root end filling materials. The outcome is usually influenced by the tooth-related prognostic factors, including the lesion size and periodontal status. Among all the outcome predictors, the presence of a major procedural error during surgery and osteotomy for the root apex identification and root end management is the most significant. The virtual reality haptics and dental training offer an effective and innovative approach to stimulate the technical and emotional aspects of the clinical experience. It allows for the reproduction for a real clinical case through the digital planning, the virtual scenario, and haptic feedback, enabling the saving and reviewing of the trainer's progress as well as the assessment of the performance and the outcome at any time. So the aim of this case report to illustrate the first creation of a novel VR haptic simulation in a modern endodontic microsurgery and its application to adequately train a low expertise level operator, a resident student in endodontics, before the execution of a supervised endodontic microsurgery intervention in a real clinical case on a patient. So this case report represented with a 34 years old white Caucasian woman presented at the endodontic unit, reporting swelling and spontaneous pain in the upper right maxilla. The patient medical and dental history were collected. The preoperative digital periapical radiographs and CBCTs were taken, which confirmed the signs of apical abscess associated with the previously treated root canal tooth, restored with the fiber posts and a composite resin core and a metal ceramic crown. The buccal cortical bone was mostly intact with a thin plate over the root apex. Periodontal probing indicated a healthy periodontal status with no detectable vertical root fracture. An informed written consent was obtained from the patient, and endodontic microsurgery was assigned to be the postgraduate endodontic resident will be performed. The resident training in the endodontic microsurgery was through a 3D printed model, a cadaver based lab training, as an observer of a live surgeries performed by an expert operator. As an additional learning experience, a novel VR and haptic simulation program was introduced to the postgraduate student utilizing a previously tested VR digital workflow, which includes generation of a digital data and creation of a VR dental simulation and the assessment criteria and feedback statements. During the evaluated stimulation, the student was allowed for the first 5 attempts to visualize the guidance of the ideal targeted area and the volume, while the guidance was deactivated in the following 5 attempts. The operator could also check in real time on multiple planes the target progress and accuracy. The resident was required to achieve 95% progress in the targeted area. The outcome and the feedback of each session were recorded to help the student better appreciate the improvements in the learning curve. Moreover, the exercises were reviewed by a clinical academics in endodontics and discussed with the student at the end of each session. The student was able to reach the requested performance criteria and the supervised microsurgical clinical procedure was approved. As going with the traditional endodontic microsurgery, which ended up with a follow-up of 1 year that the patient is asymptomatic. In a conclusion, this case report demonstrated the implementation of a VR haptic digital technique into the endodontic curriculum as an active learning and treating experience. Although further studies on a similar procedures are needed to provide more expensive data, this report conceptualized the potential of harness a VR haptic technology in endodontics.